everyone, welcome back to my channel. I am Dr. Dhanya. Today we will discuss about the high yielding topics from gynecology. We have almost covered high yielding topics from obstetrics, and from next week onwards we will start our discussions on gynae questions. So today I will give you an overall idea about which all topics are important and how to study each topic and all. So without much delay, let's get started. The first and most important one, cervical cancer and screening, and it is the most frequently tested topic nowadays because the updated guidelines came in 2017, and after that they are keep on asking questions from this topic. And you can go to the Cancer Australia website where you can find a section on cervical cancer, where you will find a list of flowcharts with different scenarios, and you can screenshot those flowcharts and by heart them, because most of the MCQs are coming from these flowcharts only. So by hearting them will help you to crack those MCQs, and they will ask different scenarios from this topic based on the management part and the next management part, next approach, like that. And the next topic is contraception. Contraception is another high yielding topic in which they will ask mainly about the emergency contraception and missed oral contraceptive pills. And you can go to the RACGP website for the guidelines for the contraception part, and they will ask questions based on the types of contraception, long acting reversible contraceptives, and the indications, contraindications, like that. And they will give you different scenarios, different clinical presentations, and they will ask you what is the best choice of contraception, like that. Example, they will ask you questions based on a patient with DVT, patient with past history of DVT, present history of DVT, patient with obesity, patient with hirsutism, patient with PCOS, patient with epilepsy, like that. They will ask what is the best contraceptive choice. You can also go through the postpartum contraception and different methods of postpartum contraception. The next important topic is vaginal discharge, because it is a very common topic asked in AMC exam, and you should know about different causes of vaginal discharge and different clinical presentations and the management part. You can go to the STI guidelines for the details based on the management part. And you should be thorough with the image based questions also, because they will ask questions on strawberry cervix, the clue cells, and wet mount preparations. So you should be thorough with the images also. Another important topic is abnormal vaginal bleeding or abnormal uterine bleeding, and this is another high yielding topic for your exam, because they will ask different scenarios based on different causes. So you should be thorough with the palm-coin classification, different causes, different investigation of choices, and the management part also. And they will ask questions based on the postcoital bleeding in young patient or in elderly patient or a postmenopausal patient. And they will ask question on a regular menstrual cycle, heavy menstrual bleeding, and the perimenopausal bleeding, postmenopausal bleeding, like that. So you should be thorough with the different causes in different age groups, like that. So that is another important topic. Another important thing is dysmenorrhea. This include the primary and secondary dysmenorrhea, different causes you should know, and in which they will ask about the endometriosis, adenomyosis, like that, and the different investigations and the management part. The next topic is premenstrual syndrome or premenstrual dysphoric disorder. This is a common scenario that will encounter in general practice, so they will ask questions based on this topic also. So you should know how to differentiate this premenstrual syndrome from this premenstrual dysphoric disorder, and you should recognize the symptoms including each spectrum, and you should know the management strategies also. And the next topic is infertility. They will ask about both primary and secondary infertility, It is another high yielding topic, and you should understand the common topics, common causes like the PCOS. In Australia, the ovulatory causes are the most common, but in Aboriginal people, the PID, pelvic inflammatory diseases, are common. So you should thorough with all these things. PID, the PCOD related questions will ask in this session, and you should know the different approaches and management part also. And the next topic, genital ulcers. This is a common topic asked in NEET PG exam also, so it will be easier for you if you have already prepared for NEET PG exam. And you should know the different types of genital ulcer, different causes of genital ulcers, and how to differentiate each of them, and understand their management part also. Another important topic is menopause and hormone replacement therapy. This is very important for your exam because it is a common thing that encounter in GP. And here they will ask questions based on the postmenopausal symptom, and they will ask the management part. And you should know the symptoms and management of each scenarios, and understand the hormone replacement therapy. There is some overlap with this with the ortho, because in osteoporosis part they will ask the similar scenarios and the management part. Another topic is pelvic organ prolapse and urinary incontinence. This is purely a postgraduate topic, and this is not that much high yielding, but you should know about the common types of pelvic organ prolapse and the grading and management part, the basic management part. And the urinary incontinence, different types. You should know different scenarios of different type of urinary incontinence, and they will give you a clinical scenario, and they will ask you what type of incontinence is this, like that. And so what is the management, like that. The basic management part you should know. Another important topic is amenorrhea, primary or secondary amenorrhea. It is very high yielding topic, and AMC will ask tricky question from this topic. Yeah, so you should know about the definitions of different type of amenorrhea, and you should know different causes of amenorrhea, and you should know the normal sexual development, Tanner staging, and based on that how you should diagnose each cases, like that. And they will ask different case scenarios, and they will give you one scenario, and they will ask what is the next best step or next best investigation in this scenario, like that. And you can make a flow chart on each scenarios, and by heart those flow charts based on the each scenarios, and that will help you in doing such MCQs. The next important topic is abdominal masses. Here they will ask again ask the questions related to the fibroids, adenomyosis, or gynec onco part like ovarian CA, like that. And you should know the management part. They will ask different scenarios like what will you do if the family is completed, what will you do if the family is not completed, like that. Another important topic is breast cancer screening and benign breast diseases. This is some overlapping topic with the surgery. Another important thing is you should be familiar with the different cancer screening guidelines in Australia, not only for your gynec part, but for the entire AMC exam. And you should be familiar with which all age groups included in different screening processes for different cancers, and how often they should be tested, like that. And the key areas asked in MCQ exams were from questions related to the breast cancer, cervical cancer, colorectal cancer, and the prostate cancer. These four are more important topics related to the cancer screening. Hope you like this session. If you have any queries or suggestions, please feel free to ask in the comment section. And if you like the content, please please like, share and subscribe to my channel, and thank you for watching.